Welcome back. With 4 convenient locations right here in Connecticut, Rocky Hill, Avon, Manchester, and Willimantic, why wouldn't you head to OSP?
But Scott, what's OSP?
OSP, yeah, you know me. All right, it's short for Orthopedic Surgical Partners, and that's where I met up with Dr. Michael Boniello and his trusty PA, Kristen. They go together so perfectly to address all of your orthopedic needs.
Now, you visited them in the Rocky Hill location at 1111 Cromwell Avenue.
Correct.
On 11/11.
Is that synchronicity?
That's very cool.
Take a look.
You're looking at someone's joy and happiness.
This is a total shoulder replacement. So this is for somebody who has really bad arthritis of the bone and socket joint. And ultimately what we do is we open the shoulder up and you take off part of the bone on the top of the humerus, and what you can't see here is there's actually a plastic spacer, and you can see a little the one part that you can see in the x-rays, a little radio opaque kind of tracer in there. So this completely resurfaces the inside of the shoulder, and this guy's been having pain I've known him for probably 2-3 years now, and he feels great.
So there was nothing humorous about a broken humerus?
Correct.
Correct.
That's Dr. Michael Boniello, an orthopedic surgeon at Orthopedic Surgical Partners, alongside Kristen Wolak, a physician assistant. What a team. Today we're talking about shoulders and knees and helping people.
Helping people is fantastic. It's, we're surrounded by wonderful people here. We have great patients, and orthopedics is a unique field where it's a very mechanical field, and just so many different facets to it. So every day is a new day, and every day is a really interesting day, and that's why we love it. I specialize in minimally invasive arthroscopic surgery of the knees and shoulders, and it's a very interesting thing. People come in and in terrible pain, dislocating joints and broken things, and we put them back together.
Kristen feels the same way.
I became interested at a young age. I was an athlete growing up. I spent probably too much time at my orthopedic surgeon's office, and because of that I became interested in the field, and I think having the experience of being a patient and having multiple surgeries, I can relate to patients well.
Patients coming to get the expertise from this team at Orthopedic Surgical Partners.
We see some similar injuries over and over. Each patient is unique, and it's nice as a PA to see the patient through their treatment. So we see them when they come in initially, we assist in surgery, and then I get to see them post-operatively too. And usually, the recovery is pretty quick.
That's if the patient needs surgery. Here at Orthopedic Surgical Partners, they will try everything first before heading into the OR.
Is surgery the last option?
It is. It definitely is. There's a lot. I actually had a patient the other day who said, we treated him. He felt 100% better, and he goes, so I swear to God, he goes, Doc, sorry we couldn't, go into the OR. I said, no, you feel better.
Okay, back to the shoulder, and why you should come here if you've got a problem.
We could actually treat non-operative. The shoulder's a very forgiving joint in that regard.
Oh, seriously?
Yeah. Some people have terrible fractures, but you could really, you kind of, do a risk assessment on it, and, just kind of talk to the patient, see what their, priorities are with it, and they heal great. The best day is when a patient feels better, and that's the God's honest truth.
Rotator cuffs, all different things like that. And
yeah, so you tear your rotator cuff. It's a very, very common thing, but very often, actually, when you look at the numbers, more often we treat them non-operatively than operatively, and people are very, very happy with that. And if not, if it's something that's persistently symptomatic, then we do a surgery and they feel better.
So we will sometimes perform in-office procedures like cortisone injections. If the patient's not a candidate for surgery, we can refer to physical therapy. And then again, if it is a surgical issue, we refer to Dr. Boniello or one of our surgeons to fix it permanently.
People come in and see us on their worst day, and especially if they fall and break something, or we also see people for worn out arthritic joints.
They also do what's called a reverse shoulder arthroplasty.
The majority of shoulder replacements we do are actually reverse shoulder arthroplasty due to rotator cuff issues.
So you literally take one part and reverse it with the other?
Yeah.
That's crazy.
Yeah. 80% of shoulder replacements are reverse shoulder arthroplasty now, due to how well they do.
That's incredible.
Yeah.
Now we're talking knees.
A lot of moving parts to the knee, so that, you know, we have 2 menisci in the knee. They're the shock absorbers of the knee, but a ton can go wrong with them. You tear your meniscus, it's super painful. It's, you know, locks your knee up, and people can't walk on that. So, you know, if it's appropriate, we fix that. Or, you know, again, it still enters the realm of, you know, non-surgical treatment.
But if surgery is required, Orthopedic Surgical Partners is here for you.
Everybody's very friendly here, and that's reflective of the people who we actually have working here. We have wonderful teams. We're very thorough about what we do, and ultimately when it gets to the point of needing surgery, everybody in their respective specialty is extremely specialized in what we do.
Well, OSP, yeah, you know me.
Should be our new motto.
I think it should be.
All right, such a great team. I want to thank Kristen and Dr. Michael Boniello for spending some time with us. Again, you can find OSP in Rocky Hill, Manchester, Avon, and Willimantic. If you're interested in meeting the team or you want to learn more, please visit orthopedicsurgicalpartners.com. Make sure you tell them Great Day Connecticut sent you. Such nice people over there.
Yeah, well, I love what you did with the OSP.
Yeah, you know.